Hi everyone, we're gonna wait just a few minutes for people to sign on. So if you could just, for now, mute your microphones. You can put your video on if you want, but we'll get started in about 2 minutes. Hi everyone, welcome. We're just waiting for more students to sign on. It looks like we've got a handful now, and we'll just wait a few more minutes. Welcome everyone. We're just waiting for students to hop on here, so we'll start in a minute or two. Sorry for those who've been on from the beginning. I keep repeating that. I see people joining right now, so. Awesome. We're up to at least a half dozen, so that's good. We'll see if we can get one or two more. Oh, I see a chat. Oh, hello everybody. Yeah, you're free to use the chat, both for formal questions and for just interacting with each other. We can all use that right about now. So. Awesome. All right, well, we've got a good size group here, so I'm going to get started. And obviously, if people join later, that's fine. So first of all, I'd like to welcome you to biostatistics. I hope that you've had a chance to look at some of the lecture content and also start on the reading and just kind of working your way through the course navigation. These Wednesday sessions are mostly a time for you to work through certain problems that you may be having, especially right now, as far as getting started with SAS. Maybe it's been a while if you did already do the SAS tutorial for $5.99. If you hadn't already done it, then obviously we want to make sure we get you set up with the statistical software that we're going to use, not this week at all, but then starting next week, you will be expected to have access to SAS again. So we also use SAS in research methods and in epidemiology. So it is something that you will be using beyond this course if it is something that if you've already taken some of those other courses, although I do believe biostatistics is a prerequisite to epidemiology. So some of you may have already taken epidemiology out of sequence, and I'm sure that's fine, but all right. Well, I think we are plateaued in our student count, which is fine. I am recording this session. If you're shy about being on camera, you do not have to turn on your camera, but it'd be awesome if you did turn on your camera. No pressure. I understand you're all maybe at dinner time or wherever you are. I am going to skip doing introductions, only because I don't want to use the whole time for that. However, if you do have a question as we move forward here, you just want to say a couple words about yourself in terms of where you live and maybe where you are in the program, and maybe what would be a good question? Oh, what experience you've had with statistics in the past. So we can do that as well. And I'll start off just by mentioning that I've been using statistical software for about 22 years now. And so when I first learned to use stats programs, it was all on these old mainframe computers, and you had to type your commands into a terminal that was connected to some big scary computer in another building. You walked across the street, always in a snowstorm, of course, and looked at your output. And sometimes it would say, oh, there's an error in your code. Go try it again. So you hustle back across the street. And so it's actually kind of amazing to me that we have now this free version of software, which I'm going to share with you today, SAS on demand. There are other stats programs out there that are equally good, and people get a little snobby about which stats program they use, but honestly, they all do kind of the same thing. And so I'm just going to walk you through tonight a little bit of using SAS, mostly to do exactly the things that we did during the first week, but to show you how a computer can do these things much more easily than perhaps you can just using your calculators. Let's see, we've got 6 of you in the room. You guys have said hello to each other. So I'm going to get started. And so I wanted to walk you through a little bit what it's actually like to be a biostatistician, or particularly an epidemiologist who uses biostatistical tools. And the way I've structured this course is to make it kind of feel as much as possible like the steps that you would go through in an analysis. So this first week, we focused on descriptive statistics and inferential statistics. And as the first step in the research process, we often want to just do some descriptive statistics based on some sort of data. And so I'm going to show you what I would do if I were approaching a research topic using data. And hopefully it will inspire you, some of you to maybe consider doing some research, not in this course, because that's not an expectation, but that you'll consider using data of some kind when it comes time to be doing your exit project, whether it's a capstone or internship. Getting any sort of publication to your name is a great way to build your resume, especially as you're trying to distinguish yourself among your peers. Someone who's published, it says a lot about several things. One is that they have the ability to finish a project and see it to completion, which I think is important. It also demonstrates, I think, teamwork. If you look at any academic article, you'll notice there's sometimes a half dozen authors. And so it also signifies that you have worked with a team. And the other thing it signified is you've done due diligence as far as doing background reading and really being thoughtful about a topic. And so it's one way to build your resume, not just because you're contributing to the scientific literature. Who knows if anybody will actually read your paper? I always wonder with some of the papers I write, who's reading it. But you hope that by doing research and by collaborating, that you can build upon what you've done and go forward. So the example I'm going to provide today is similar to research that I've done in my career, both at the Cleveland Clinic, which is in Cleveland, which is where I'm from originally, and then more recently I was at the University of Washington, and I'm still based in Seattle. Isn't it beautiful? Tropical trees in the background. Now I'm actually at a co-working space in Seattle. I don't know if co-working is something that happens down in San Diego or wherever you are, but I am in a co-working space. I couldn't stand being in my apartment anymore. So if you see me in different rooms each time, none of them are my house. But both at the Cleveland Clinic and at UW, even though my title was epidemiologist, I was working in clinical settings, mostly focused on things that are happening among clinical populations. So when we talked in this class about getting estimates for a population, often we're thinking in terms of the United States or something like that, or some counties if you work for health department. But one could think of a population as a hospital or a group of patients for which you are specifically interested in. So, for example, if your area of interest is in pregnancy, women who are pregnant and fetal outcomes and things like that, that is a population in of itself that we're looking at, not the overall US population, but things that happen within a specific population, like the maternal population. Or you could be thinking about it in terms of specific clinic. But when I'm talking about clinical epidemiology, it's more about people who have a specific disorder and whether or not they're receiving adequate treatment, whether are there disparities in the quality of care. And so I'm going to walk you through just a quick little example of how I might get started doing a research project and tie it into what we're doing in this class. Okay, so let me advance to the next step. So when you are considering doing research, and really biostatistics is about making it so you can do research. There's really no other reason to learn it. The other application would be for doing things like predictive modeling and things like that, but that really is also kind of like research where you're maybe wanting more immediate results, like a lot of the stuff that's happening with COVID right now. But the processes that you would use would be pretty similar, whether it's for something you're going to publish or if it's something you're going to report out. So you basically start off by developing a research question. That's often the hardest part. You don't say, hey, I've got this data set, what can I do with it? You should start off with a research question. As a student, it's particularly hard, I think, to think of research questions because you have to say, well, am I going to draw from my personal experience? I had someone in my family who had ALS, and so therefore I'm going to do research on ALS. So it's one of those things that kind of comes about as you immerse yourself in a setting or within a body of research. Some of us are super passionate about certain topics. Could be for personal reasons, it could be things that affect our community. But a good research question really is one that there is some demand for the answer to that question. And often where we find those questions are in the scientific literature itself. If you read through articles on a topic that might interest you, often if you read the discussion sections of those papers, they'll say, hey, this is really the next step for research. This is what we need to know. Sometimes those questions may arise from your own day-to-day activities and work that you've seen some sort of trend or change in a population that you're working with, and you're curious to see if that's something that's happening nationally and if there's some way that you could intervene or develop some sort of prevention tool to shape the course of whatever it is you're interested in. So that's a whole nother part of the research piece that we don't really go into in the course of biostatistics, but it is something where you should start off with a good research question. As a biostatistician, I often get called in to work on studies I have no interest in. For example, I was working with a lot of orthopedic surgeons here in Seattle at UW, and they were studying every conceivable bone in the body. We're wanting to do research on hand and elbows and all kinds of joints. And I was like, I was joking that I'm going to eventually just like do an anatomy chart and just check off all the body parts, you know, that I've done research on. Not my passion area, but that's one of the things that happens when you get to the level of being an actual biostatistician. You're kind of a gun for hire. But throughout my career, I've also done a lot of research in areas that I am interested in, which is psychiatric epidemiology, particularly the adequacy of care within psychiatric settings. But so that's where research questions come from. We also want to develop a research plan so that we don't just willy-nilly go in and start playing with data and going crazy with just getting our feet in the data. We want to start off with some kind of research plan. And what I always recommend that people do when they're going to start on research is, what is your table one going to look like? When you present your results, what is it that you want to present to your audience? What is it that you're actually studying? And I would go further and say, what is your table two going to look like? What is your table three? What, not that you're going to come, what is your conclusion that you're going to come to, but what are the things you're going to measure? How are you going to measure them? Those are really, can be really guiding ways in which to further formulate a research question. And then it's a matter of finding the right data source or recruiting people into a study, which is obviously much more labor intensive. So for example, well, I'll get to that in a second. I'll go through these steps and then I'll come back to developing a research plan. Then you obtain some sort of data, okay? And I will talk in this course a little bit about how you can get access to certain types of data. Often it's through professional settings or connections that you would collect data through clinics or what have you. Then you have to go through some data cleaning. Often the data sets that we use in this class are already perfectly clean, meaning there aren't missing values, there aren't outlying values and things like that. We try to make it a little less messy than the real world. But that I would say I spend a good 20% of my time, if not more, with the kind of data manipulation pieces. And by manipulation, I mean just getting it to behave so that we can do a study. So making sure that we have addressed any missing values, that we've addressed errors, and know what all the coding means in the data set. Okay, so that gets us to performing descriptive statistics, which we're talking about in week 1. Then we would start doing bivariate analysis, which we're going to study in week 2, and then multivariate analysis, which we will cover in week 3 and week 4. And so, in thinking of where we are in this course, we're not going to start off with research questions. We're not going to develop a research plan because this is just to learn how to do the other steps. But this is kind of a background. So let's start with performing descriptive statistics, and I'll show you what I have as a research question to just kind of guide some of this descriptive statistics. So I'm interested in concussion as a phenomenon, how it's treated, how much it costs, but I have a more specific set of questions, which is the standard of care for adults is to receive a CT or other X-ray scan. Okay, that's a statement, it's not a question. But under most circumstances, especially if they present to an emergency department with a concussion severe enough, adults should receive a CT scan. However, there's been a movement to kind of reduce that because of radiation exposure. And so there are specific indications for using an X-ray. For children, use of CT scans should be used relatively limitedly unless there are specific circumstances that they meet certain criteria. So my background here is that I'm interested in these overall topics, but my formal research question is going to be, what proportion of adults and children are receiving appropriate care for concussion? This is nationally. What are the predictors of receiving CT scans among children and adults? And are there disparities by things like insurance status or race, ethnicity? And I'll just leave those questions, or those as our kind of sub-questions here. Okay, so those are what research questions might look like. These aren't terribly interesting ones necessarily, but they're probably important because the guidelines on care are changing. And so if we can get a good representative sample of patients across the United States, we can start to say, hey, well, are we even following our current guidelines? Are we giving optimal care to our patients? So this is what's guiding this particular analysis that I'm about to perform. Okay, so the data source I'm going to show you is from the National Hospital Ambulatory Medical Care Survey. It is a representative sample. Literally, they randomly select hospitals, and in this case, emergency departments across the United States. And then from that, they randomly sample electronic medical records and abstract the information. So in the lectures, I often talk about having representative data, random sampling. And so this data source is one which has fairly rigorous methodology as far as truly extracting a random sample. And so that's why I chose to use that data source for this, to analyze this particular topic. It also collects a lot of clinical measures, including some of the indicators that would be used to determine whether a specific treatment was indicated, whether a scan is indicated. So things like a coma score and all kinds of other clinical measurements, which I'll show you in a second. The other thing that's good about it is it uses a standardized coding scheme from electronic medical records. And so they have people who are trained to extract information from medical records, and they do it in a very uniform way. And so this is then synthesized into a data set, and it's done every year. Okay, so I've taken the aggregate data from multiple years, the 6 most recent years of data, to start to be able to look at this question about concussions that I have, which I just picked out of a hat as a possible topic. Okay, so let me show you, switching gears here. screen. No, it's got my screen. Okay, so I'm going to go to SAS. First of all, before I do that, I want to make sure that all of you who have not already done the SAS training, there's the SAS Programming 1 Essentials course, and I provided links and instructions in Blackboard on how to access these materials. If you didn't do it as part of 599, you will need to go through this training before moving on in the course. And there are 7 lessons. There's also a course overview and data setup thing, which is really important not to skip that step, because that is what sets up the different folders and things you'll need for SAS on demand. So since this was a prerequisite for taking this course, if it's something that you're struggling with, we can talk about it in a moment. You can also set up office hours with me, and I can help you walk you through the steps to get enrolled in this and set up. If you follow the instructions that I provided, it should be relatively straightforward, but people have different machines and sometimes it doesn't cooperate. Okay, so there are 7 lessons, and they're really more about how do you read data in, looking at your data, and they do some examples of basic analysis in there, okay? So I'm gonna use this as a slightly more motivating example. And if you forget how to get into SAS on demand, it's pretty easy to find it. And once you've established your account, which is free, you click on SAS Studio. Always the connection's slower when I'm doing it live, right? Okay, here we go. Okay, so I've been playing around in here, so it may not look exactly like what you have, or it may not open up exactly like you have. But I'm going to show you some things that will parallel what we would do for descriptive statistics. So I already mentioned that we're looking here at the National Ambulatory Healthcare Survey, and my question is around concussion. And I don't expect you to be able to do this quite yet, but what I did here in this code is from this larger data set, I extracted any record where the diagnosis was for concussion. So this syntax here all has to do with saying, hey, I only want to have the population in my sample who had concussions. Okay, so that's what that's all about. I'm not going to go through all the detail on that for now. And then, so I'm going to run that. Okay, so this is a data step that I'm creating here, which you'll go through in the training as well. And I'm going to run this real quick to make sure that I've got a live version. Awesome. Okay. Sorry. Didn't mean to clap loudly. So what I've done is I've actually read in not only all the data from this data set, but I actually subsetted it to look strictly at the concussion population. And I know I made that look really easy, but I mean, it looked like it was just a couple clicks, but I had to go in there and do that coding. But that was, that kind of goes beyond this course, but I'm happy to work with you, especially when we get to the SAS homework, if you want to do some coding. But for now, we're going to learn how to do SAS programming by using the visual programming feature. And this is a nice way to learn how to use. So at the top of my screen, which I hope you can see here, there's a visual programming. which is already where I am here, okay? And if I go down here to tasks and utilities, there's all kinds of really cool things we can do. um, and the first set of tasks have to do with data. So filtering data, transposing data, um, sorting, ranking, transforming, recoding. These are all data steps where you would maybe work with your data to get it set up the way that you want. That could include things like making a continuous variable into a categorical variable, or those kinds of steps. We're not going to focus on that too much in this course, but this is where you would do things like recoding and stuff like that. I'm going to go down here to well, and then the next section is graphs, and we already talked about doing histograms, bar charts, box plots, things like that. And even though you often see statistics presented as graphs and bar charts and so on, I'm not a huge fan of it, nor is the scientific literature, unless it's something that really requires visualization. If you could tell it just the story just as well with a table with descriptive information, use a table. If it's something that you could truly only visualize, like a distribution or something like that, then it's appropriate to use visualizations. So I don't want to say don't ever do it, because I'm asking you to do it as part of this course. But when it comes time to doing actual analytical work, we try to avoid unnecessary graphs, because it's very easy to distort a graph in terms of the information. So we're going to go here to the statistics portion. And you can see in here, it kind of goes from the more basic or descriptive to the more multivariate in nature. And you can see even some of the headings here. We've got linear models. Later in this course, we're going to do linear regression, survival analysis, which if we get as far as I hope, we'll actually do survival analysis. What else do they have here? And then it gets into some specialized things down here. But we're going to start up here with summary statistics, okay? And so I read in this data set, and we're going to be able to kind of look at it here. If I go to the output data, and I'm going to give you access to this data set next week. So I'm going to do a little more cleaning of it, like I said, because nobody likes a big dirty data set when they're trying to do analytic work, okay? So this data set has clinical information, and I've subsetted it down to only those patients who had a concussion. It has the month that they visited, and I can see this if I click on the variable names. It says month of visit here, the day of the week, what day of the week did they come, Mondays, Tuesday, etc. Arrival time, waiting time, age, and a bunch of other things. If I scroll down this list, I've got all these different variables, okay? So this is why it's important to start off with a research plan, because it'd be really tempting to say, oh, I'm just gonna look at all this stuff. I'm gonna just like see what's associated with what, publish a paper. So ideally, I would, before I even start, say, well, these are the types of measures that I would like to include in my study. So I've created a little mock table 1 here. Oh, I didn't call it table 1, but I will. Study characteristics of patients presenting with concussion to emergency departments. Okay, so this is my table 1. And this is where I'm going to put in the values that I want to portray to my audience. I'm also interested in them analytically to answer those research questions that I started off with. Don't forget, the research question was, are adults and children receiving appropriate services in the form of CT scans? And are there any disparities in the population, and so on. So I'm not going to look at every conceivable variable. Oh, no, I'm sorry, what are the predictors of getting a CT scan? So in my table one, and again, I could have created this even before I knew which data source I was going to use. I'll say this is just my wish list of measures. So I know I'm going to report age. Age is always usually at the top of table one. Age is related to every health condition that I can think of. Unfortunately, as I get older, I realize that no, but there are age differences in treatment response. There's age differences in all kinds of things. In this case, age is going to be important because um, it's one of the decisions that's going to be made whether or not a patient receives a CT scan or not for a concussion. I know I'm going to want to look at this by sex in advance, race, ethnicity. Now, this is changing as far as how we characterize these things in research, but I'm not going to go down that path right now. But this is how data was stored in this data set. So I have chosen to break it down this way: white, black, Hispanic, Latino, and other. Some of these categories are problematic, but I didn't create them, so let's go on. Insurance type: private, Medicare, Medicaid, others. So I'm interested in insurance status as a potential factor in not only as an independent factor in determining what kind of treatment people get, but also if we see disparities based on race, ethnicity, or other things, how much of it is potentially explained by insurance status and things like that. And then finally, I'm going to report the proportion who received imaging. So right now, I'm just keeping it as any imaging, CT scans, X-rays, etc. Okay, so notice my wish list here of variables is relatively small. I could have, in a real study, I probably would have expanded this to have a few more clinical measures. But basically what I'm doing here in table one is saying who is in my sample. That can help the audience and help you to just kind of get your handle on what this data looks like. Okay, so using this as my kind of guiding tool, I'm going to try to plug in all of these different values into this table. So I'm going to show you how to do that. And again, this is descriptive statistics. This is measurements based on a sample. Okay, so let's see if I can figure out. Okay, so my first task is to look at age. Okay, so I'm going to go down here to summary statistics. Okay. And I click on summary statistics, which summary is basically another way of saying descriptive. Okay. And it's going to ask me which data source do I want to use. I have created all kinds of mess here. Data set. Oh, I want C, I think. Sorry. Make sure about that. Okay, I'm going to assume. Yeah, that was it. Okay. Sorry about that. Okay, summary statistics. And first of all, to make sure that I'm working with the right data set, I'm going to go all the way down to my concussion variable, and I should have just the concussion group in here. So using this visual programming thing here, it actually generates code for me. So as I was interactively doing this, I put this concussion variable. It created this code over here. It says proc means, data set source, which statistics it's going to give me. Okay, so I'm just doing a quick pass here to see what's in here. So I click on this little running guy. Oh, I did the wrong variable. It's telling me the mean was 1. But actually, I got the information I needed. N of 408. Okay, so I'm working with the right data set. I happen to know that this is the right data set. So there's 408 concussions in the sample. So I lucked out. I shouldn't have done a mean, I should have done a frequency. So let me correct that. I'm going to do a table analysis on the same variable. I'm going to click on the plus sign. I'm going to go all the way down to this variable that I constructed called concussion. Okay. And now again, it generated this code over here in this code dialog. I'm going to run this portion of the syntax. Okay, and here's a perfect example of why we don't want to overdo graphs because all it did was show me that there's 408 people who are in my study, and they did this one big bar that goes up to 408, a totally useless figure. But okay, so this is more appropriate. There are 408 people who had a concussion. Okay, there's nobody in this data set who didn't have a concussion. That was my goal. Okay. So my first step here was just to say, am I working with the right data? And I am. Okay, so back to age. So I'm going to go back to my summary statistics. And I'm going to select the variable age, which happens to be there towards the top. Okay, and the default is going to give me mean, standard deviation, minimum, maximum, and the sample size, okay? But I don't have to live with that. Now notice here, it says mean, standard deviation, min, max, m. If I go to options, I can ask it for the median. I can then click on additional statistics. I can ask for the variance, the mode, the range. I'm not going to ask it for everything. That would be greedy. I can ask for quartiles. Oops. Lower quartile, upper quartile. So the lower quartile will be Q1. I'm sorry, Q2. Upper quartile will be Q3. And okay, I think I'm being greedy now. But notice over here in the proc mean statement that it actually automatically populated my code with those changes that I did interactively. So in terms of learning SAS programming, this is a great way to learn. You can actually see how to generate the appropriate code. So now it says mean, standard deviation, min, max, median, sample size, mode, range. Okay, so I'm going to run that. Again, I'm going to click on the little, I'm going to click on the little running guy here. Okay, it's a little hard to see. Not one of the best features of SAS on demand because it's hard for me to make this larger. But I'll read off the values in case you can't see this on your screen. So the mean age in my sample, this is people who present with concussions, was 28.7. The standard deviation was 20.4. The maximum age was 93. Oh, sorry for them. The minimum, oh yeah, minimum was 0 years old. So there was a toddler in here. The median age, 22. Notice that the median is quite different than the mean, 22 versus 28. And we'll see why that is here in a second. I've got my N, which is my sample size, 408. I asked it to produce the variance. The variance is 417, which is very hard to interpret, like I said, but it's the total number of ages that varied from the mean. The mode, 16, so the most common age for a concussion is 16. And if you recall in the lectures, or if you haven't watched already, I did mention that one case in which the mode can be interesting is like what's a really common value for kids to get a concussion, or sorry, in the case that I did in lecture, it was when do they start using alcohol? The most common age, the most common represented age in this data set is age 16 for concussion. Makes sense, right? That's when kids start driving. So I can't say whether that was the reason that they had these concussions. They're also involved in more school sports, high impact sports. There could be a whole range of reasons that 16 is the mode, but it's not totally uninteresting. Sometimes the mode is totally uninteresting. The range is simply the difference between the minimum and maximum age. And then I've got my two values for the quartile, 14 and 41. That means that 50% of values fall between 14 and 41.5. Okay, so I've already got quite a few things that I can put into my table. And so I've got mean age is 28.7, standard deviation 20.4. I'm also going to report the median, which was 22. And the way we present interquartile range is with a bracket as opposed to parentheses, and that goes from 14 to 41.5. And I'm going to make that 42 because we're talking about ages. So I'll round up. Okay, so I already have my first element in my table, which is a descriptive statistic about my sample. Now notice I did not say anything about inferential statistics at this point. I didn't say, oh, I want to know what the true population mean is for concussion. Now, it just so happens that this data set would be a good one for me to do that. And I will show you how to do that momentarily. But that would not be appropriate for me to present into this table unless that was my specific goal. But if I wanted to say what the mean age in the population, I could simply, if you see here in my additional statistics, there's a confidence limit for the mean. So if I click on this, notice that it defaulted to 95%. I think I mentioned in the course lectures that you're going to use 95% unless instructed otherwise. So I'm not surprised that that was the default. It doesn't let me put other things, but normally we're going to do a 95% confidence interval. So I'm going to go ahead and rerun that code and get a confidence interval. Okay. So I've just made the leap now to inferential statistics. I went from purely descriptive, saying who's in my sample, what is the standard deviation, et cetera. Now I've created this confidence limit around this mean, and it goes from 26.7 to 30.68. And I could say that the true population average of patients who who present with concussions is somewhere between 26.7 and 30.7. Okay, the reason that confidence interval is fairly wide, so from 26 to 30, is because my sample size is only 408. Even though this is a pretty big study, the proportion, it wasn't specifically about concussion, and so I might want to use a better data source to get a true grasp on the population. But even with this, I could say that the true population mean is very likely to fall between 26.7 and 30.6. Okay, so that would be the inferential piece on this part. Okay, so now I'm going to quickly show you how to get a proportion. And so in the first week, I was talking about levels of measurement, right? So with a continuous variable, we're going to use things like mean, median, mode, interquartile range to describe it. For a categorical variable, I simply want to get frequency counts on that variable. So I'm going to use a slightly different feature. keep having to move myself, my picture out of the way. So I'm gonna run, oh gosh, I didn't mean to do that. Okay. These laptop screens are so small. All right, so if I go to table analysis, this is where I'm gonna get my frequency counts, okay? So some software packages, it might actually say frequencies. Here they call it table analysis. And basically a table analysis, you can do a one-way frequency, you could do a crosstab, which is just frequencies across different variables. So I'm gonna plug in my frequency on sex. Okay, notice over here, it generated a proc freq statement, which is a frequency count, and it's going to give me a little more than I want, but I'm just going to go ahead and run that because I just want my answer. Okay, so it gave me, there are 216 with the value 2 and 192 with the value 1. These numbers in this case are not true numbers. They are simply codes that represent representation in group 1 and group 2. I happen to know from the code book that group 1 is female and group 2 is male. So you wouldn't know that necessarily unless you looked at the actual code book for this data set. And this is actually not necessarily always standard, so you have to be careful. But I do know that that is the case. Now look at here, it did automatically generate a bar chart, which is an appropriate way to present sex. I'd obviously want to change the labels here from 1 and 2 to male and female, but it showed me the absolute frequency of men and women. Here's another example of where bar charts really aren't that much more informative than a table. So I'm going to work on improving my table to be a little more interesting, or not interesting, but informative. I'm going to go to options here and say, give me the column percent, because I want to report that on my table. Can I get rid of the plots? I'm going to get rid of, well, I'll just run it anyway. Sometimes it's easier just to run it. Oops. Okay, so I'm going to run this code. Oops, I thought I added. Oh. I'm going to try that. Sorry about that. Okay, that's what I wanted. I don't know why I didn't do it last time. So now it's given me the frequencies, the relative frequencies, which it just calls a percentage, which is appropriate, cumulative frequency and cumulative percent. Well, since this is a categorical variable, cumulative frequency is not very interesting, and you can see that cumulative percent is exactly the same as the percent. But I was just using this to get my percentages so I can put it in my table. So I've got 192 women or 192 females. There's some children here. 216 males. So I can go ahead and plug that in my table. What did I do with my table? Oh no. Somewhere here. Okay, so now I have a frequency of, so I'm going to put my N of 192 females and 47.1%. Okay, and male 216, 52.4, 52.9%. Okay, so hooray! I've already gotten halfway through my table 1 in this session. I would follow a very similar, since these are all categorical variables here, I would just run frequencies or tables, proc freaks on each of these other variables, including receiving images. So I'm going to go ahead and jump ahead to that variable because that's my outcome. And I'm just really curious to see what proportion had. And I actually don't know the answer to this. So this is very exciting stuff. Okay, so I'm going to go to table analysis. And I happen to know where this is in here. Okay, so here's where we start to get into different screenings that are done. Toxicology, urine. I'm going to click on this one, X-ray, they have CAT scan, CT contrast. I'm not going to break it down into those quite yet. That'll be more of a detailed table. I'm just going to do any image. And this will be how many received any kind of imaging. This is just a first pass look. Okay, so 288 got some kind of imaging done and 120 did not. So imaging would either be CT scan, MRI, or X-ray, possibly some other ones. So I would then put that in my table for yes, no, 288. And obviously I would alter the syntax to allow myself to get the percentages, or I can just calculate it by hand. Okay, so, all right, so I'll leave it at that for now. But the reason I wanted to do this demonstration was, first of all, descriptive statistics are what we do based on our sample. It is simply just saying, what does our sample look like? And we can present that in table 1. And obviously, that part of the research project is not that interesting necessarily, but it just kind of gives an overview of the sample. Now, if I wanted to do a chart, a histogram, I'm going to go up here to histogram. And just quickly do age. And now I'm going to run this goofy syntax. Okay, voila, voila. I've got my histogram. And it shows me the age distribution. Now it automatically binned the ages for me. I could have asked it to give me each specific year. It looks like it threw it into like 5-year buckets or something like that. But it's enough for me to look at the distribution and say, okay, it's definitely a skewed distribution. We would actually say this is skewed to the right because the tail is off to the right here. So you can see that not only was 16 a common age, 16 is just part of this column here, but it tends to cluster here between ages, looks like about 10 to 25 or so, okay? And if I wanted to break that down further, I would tell it to create a slightly less bunchy, less binned up histogram, okay? But this is why the median was so different from the mode. I'm sorry, the median was so different from the mean, right? So the mean was like 28, right? The mean was somewhere over here, but the median is over here at like 20 something, or low 20s. And that's because this distribution is skewed. It's not a perfectly normal distribution. And so there are more values bunched up towards the beginning of the distribution. That moves the median to the left as well of the mean. So the mean is out here, the median is somewhere over here. And so this would be a good example of where reporting both the mean and the median would be important because it is skewed. And so the measure of central tendency in this case that would probably be the better of the two would actually be the median, because it is a skewed distribution. Okay, so that was just a little wet your whistle kind of demo on kind of what we mean by descriptive statistics and how I would actually apply that to starting in on a research question or a research project where I step by step. And later in this course, I'll start to show you, okay, so what are we going to do now that we have our data and set this up as a bivariate analysis where we start to look at the relationship between age and the likelihood of having a scanned on, between race, ethnicity, and having a scanned on, et cetera. When we start to get into the research question part. And then the final step will be to say, well, there are multiple factors that predict whether somebody gets a CT scan or not. And so how can we model all the different factors simultaneously, taking into account potential confounding and other issues that we're going to talk about later in this course, effect modification, where it may be true for one group, but it might be not true for another group. Maybe there's differences by age, differences by sex. So this will be a nice opportunity to kind of see how we do all the different kinds of analyses. The other thing that's nice is it looks like we have enough of our outcome of interest. It was like roughly half-half who had a CT scan and who didn't. Let's see here. What did I do? Okay, so actually it's 2/3. So 2/3 did have, which would be like the more common thing would be to have the CT scan done or some sort of imaging. 120 did not. So right now, I already know that we probably have a big enough sample to look at this question and start running some models to say, okay, what predicts whether or not a patient gets a CT scan or not? Okay. All right, so that's the end of my little demo. I want to open up the floor now. I will normally allow much more time for questions, but I just wanted to get us started. So I know we're already hit the 7 o'clock hour, but what questions do you all have? You can either enter in the chat or you can speak up. It's been all me so far. Let's see, look at the chat. Oh, okay. I'm looking through the chat now. I will answer your questions. So I saw hello, hello. The syllabus is confusing. There are 2 pages and say, oh. Okay, well, I will look at the syllabus. Did you want to clarify the question, Frank, for me? Or we can do this offline if you prefer.
Hi, Professor. This is Nicolette.
Okay. Hi.
Hi. In regards to the quiz, will it be a mixture of multiple choice questions or problem solving?
Yeah. So the first test, especially first quiz, is multiple choice, a few true false. There aren't. I don't believe there are any calculations. No, it's just, but there's some of it is interpreting. Oh, I'm sorry, there are some calculations. I take, oh no, wait, not for the quiz. No, not for the quiz. Never mind. The homework has some calculations.
Right, the assignment, yeah, I saw the week one
quiz does
assignment.
not. It's just multiple choice.
Okay.
And I would strongly encourage you to repeat. Each week I provided the Quizlet keywords. Definitely study all those keywords. Those are those keywords come up in your book, and I've taken them from each chapter. I don't know if I include them all because some terms aren't necessarily that important, but you should know those keywords not only for the quiz, but kind of as we go through the course.
Okay, sounds good. And then,
yes.
Oh, sorry, go ahead.
No, you go ahead. It's your time.
For SAS, I see I've never taken the program before or have any
Okay.
experience with the program. And I saw that it's due on the 8th. Is that just the completion for the certificate portion of it?
Yes, yeah, and yeah, or at least show me that you are working on it. Okay, so for any of you who are in that situation where you didn't previously complete, just show me where you are. Just send me a quick little note by Sunday, say, hey, I'm on lesson 6, I'm getting through it. I want everyone to get through it, but I mostly want to have everyone set up with SAS on demand and be able to use it. Okay, so that's really the goal of doing the tutorial. So I'm not grading it, but I do need you to all be set up with it. So if we could troubleshoot, get you hooked up, that'd be great. And if we need to do that through office hours, the next question on here was one of my office hours, 1 to 4 p.m. on Thursdays, and that's by appointment. Just send me a note. I keep that time set aside for appointments. But if it does not work for you, you're working or whatever, you're stationed somewhere, then you can just send me an email. We'll come up with a different time to do that. Are there any other questions?
Yeah, I had a quick question regarding the homework assignments. I printed mine because it's a lot easier for me to work on it when it's printed. So regarding submitting it, do you want me to like take a picture and upload it or just type the answers?
That would be fine.
Okay.
Yeah, there's always ways to get it to me.
Okay.
Yeah, what I would suggest doing is you could take a picture. You could actually insert it into a Word document, right?
Okay.
So, and then you could upload it that way. I don't know what the restrictions are yet with the Brightspace Learning, if it'll accept a JPEG or something like that. But I'm fine with that. Or you can send it by email. Like you can always attach a picture by email, right? So,
Okay, yeah.
you know, ideally convert it to Word or PDF. But I totally understand. I prefer to read offline, work offline. So that's fine.
Okay, thank you.
Has anyone, does anyone need to show them how to get set up with the tutorial? You can just type in the chat or speak up. You all found it. So I'm going to quickly show you here. In case you're being shy. So I just showed you the little menu here for the learning, but if I go if I just Google it, and there's also instructions in the course, but SAS Programming Essentials 1. Okay, SAS training. And this will take you to the programming one. It's a little confusing here. You just click on the e-learning tab or where it says e-learning. And that's actually not what I wanted. Let me go back. Sorry, I did a bad job. Oh, that's right. Oh, here it is down here. Okay. I just didn't scroll down. So you'll see here, it says add to cart, start. Ignore all this other stuff down here, classroom and live session. We just want the self-paced e-learning SAS program with essentials. And then you'll click on start. And it should take you straight to the lessons page as long as you have set up. Notice I'm already logged in here. So you need to set up a login, but it'll take you to these modules. And make sure that you do this course overview and setup step. One thing I'll show you too, though, real quick, is with these lessons, you're always going to want to do the SAS Studio examples, okay? For whatever reason, when they created this training thing, they also have the SAS Enterprise Guide. You're not going to do both. You'll just do the SAS Studio because that's what we're using, okay? It's really confusing. And that's true also with the setup. Make sure that you're doing the setup for SAS On Demand, SAS Studio, not this enterprise guide stuff. I think they just bundled it all together into one thing. So some people have a different software that costs a ton of money. We're using this SAS Studio. Hope that's helpful. Any other questions? Okay. Too little work, too much work. Trying to ease you in here. So if it seems like too little, it's not going to get much more intense, but I just want to make sure you're not bored or anything.
Too little.
It's too little?
No way.
Okay. Nobody wants to be that person who says, give me more. No, but seriously, if you want more, I'm fine. I'm happy. I love statistics, so I'll be happy to set you up. But okay, hopefully it's just the right amount. And I am really trying my best to appreciate the fact that you all are now in a professional program. You want to learn to start doing analytic work in your field. And I'm trying to avoid a lot of the background stuff on probability and things like that. You can read about it in your textbook, but to do the work that we're going to do, as long as you're understanding the concepts, I would much rather focus on learning how to actually use a data set and start doing some analysis, because there's a huge demand for people who can do analytic work, and I don't want people to get discouraged because of some theoretical concept that just blows your mind and you're like, I don't understand what this is. Because if you saw, as I was doing the data analysis, especially when I was doing during interactive mode, just picking my tool, picking my variable, generating output, all of you can do that. It's not, I'm not saying it's not, doesn't take practice, but like there's not this barrier for people to do analytic work. And so I'm trying to make it clear that you can all do this. And it's really important you be able to work with data, whether it's for research or even in clinical settings. So, all right. Any other questions? I will check the chat one more time. Oh gosh. All right, I think we are good. Oh, there was a question about an inconsistency in the syllabus. Frank, did you want to clarify on that? Sorry to put you on the spot, but I just didn't understand the question.
No, sorry. Yeah, it shows the syllabus like week 1, week 2, week 3, week 4, but then there's a suggested timeline for completing activities. It just threw me off because on the, I guess the first column all the way to the left on Monday, it goes week 1, week 2, week 3, week 4. And I'm checking like the days, like Tuesday, it says read chapter 4, then read chapter 5 on week 2. And I'm like, wait a minute, I'm pretty sure we're reading more chapters than these 3 for the course.
Oh, I'll double check that. If I need to, thank you, Frank. it's possible I made a mistake in what I uploaded, or it just, I will double check that. And if I do update the syllabus, I will let everyone know.
All right, thank you.
Yeah, for the readings, make sure that you look at the readings tab for each week. So for this week, it's chapters 4 through 6. Oh no, I'm sorry. Yeah, I'll double check that. But what I did is I switched it so that chapters 1 through 3 are optional now, or background. The way the course used to be run, you'd have to go through chapters 1 through 3. To me, chapters 1 through 3 are epidemiology, not biostatistics. And so there are concepts in there that are valuable. And I do hope that you can kind of skim and scan, but do not get bogged down in chapters 1 through 3. We're going to start with chapter 4, which is descriptive statistics. And then, yeah, chapter 5, which gets into probability theory. And then chapter 6, which is about confidence intervals. Those are the 3 chapters you should read this week.
Oh, excuse me, one more. Are we getting quizzed on chapter 4 through 6 or 1 through 6?
4 through 6. Thank you for asking that. Yeah. Yeah, and the key terms that I popped up there are all from chapters 4 through 6 as well. All right, any other questions? All right, well, you're always free to just ask away during by email or to set up office hours. I'm real happy to chat with any of you, and especially if it's something like I haven't figured out how to get hooked up with SAS, or I'm not understanding this concept. I want to make sure that you get it, and so we can go on to bigger and better things. So this first week is a great week to make sure that you feel like you're staying on pace and on track. And then future weeks, I will, I'm going to post all of week 2 soon, and then I will post weeks 3 and 4 shortly thereafter. I just didn't want it to be like completely overwhelming with the amount of content. If you're ready to race ahead, I can maybe get you set up by Friday, but we'll just kind of, if you can just self-pace within the week, that would be great. All right, everybody. Well, thank you for taking time out of your very, very busy schedules to meet with me during the evening like this. And next week, now that we'll have had a week under our belts and some readings, we'll dig in a little deeper. All right. Thanks for joining us, and I'll talk to you soon.
Thank you.
Bye-bye.